Yes.
Hello, everyone. Welcome to our spinal workshop on sports injuries. So we're going to kind of cover the most basic ones or the most common ones we see: elbow, wrist, knee, ankle, a little bit of hip, and the neck. So if you have any questions or concerns after watching this, if we haven't covered it, feel free to let us know. Other than that, let's get started. So sports injuries, rehab and prevention. So why do injuries occur? Easiest answer is we're either not prepared for the event that we're going to be participating in, or it's a contact sport and you get some sort of injury that way. The less common ones are not stretching, trigger points. So you got to do your prep work and work out before you're doing whatever activity you have scheduled that day. Soccer, football, even just a basic weightlifting. All of those ones you got to be stretched, warmed up, and ready for. So overuse, we have quite a few sports injuries that are from repetitive motion. So the common ones we see mostly are from volleyball or tennis. So you get tennis elbow where you're constantly going like this, or volleyball where you're always hitting the exact same motion. So you're overusing either that joint or those muscles. Running, knees, ankles, those can get a little comfortable if you're not strengthening them or using them appropriately, but they can get overused even though we walk and use our legs. Hopefully for most of the day, you're not sitting or stationary, but if you are, that can be some additional issues. Bass shoe company stores, so that would be a Dr. Bill, who's in Africa right now. So on the next video, we'll have him explain that story. Previous injuries, so if you have a knee injury or an elbow injury that has kind of healed and then you overuse or do something that you're not used to, you can re-injure those particular joints or muscles. Hypermobility, so we have some people who overstretch. Dancers, this can be a common thing for you guys. I was a ballroom dancer. Some of you might not know that, some of you do, but this one I didn't really struggle with because I had hypomobility. I didn't stretch very much when I was playing football and soccer and Little League. But as I started doing more stretching as a dancer athlete, I got a lot more mobility and was able to use different muscles that just wasn't using before. Hypomobility, as I just talked about, tightness issues. So any particular portion of your body that's just not quite moving right. Bodybuilders, my older brother, he's a weightlifter. He was a power lifter for a while until I got into chiropractic school and told him to knock it off because he kept getting low back pain. But those guys who don't stretch, they just build muscle, they tear the muscle, which micro tears are, and that's what kind of builds muscle, but they don't do the necessary stretches afterwards. So unfortunately, this is where I come in and say CrossFit has a great idea with the stretching and strengthening. The only issue is the crazy workouts that they do in order to get that strength in those particular areas or what causes the injury. It's not necessarily the basic motion or exercises that they're doing. It's when they start doing the crazy ones or they start overusing stuff. But majority of the issues that we come across, pain. Pain is the number one signal we get to say, hey, something's wrong, and our body wants to lock down and not let it move or do anything so that it can heal properly. Two trains of thought. One is that it's good that the body has that mechanism so that we know, hey, painful here, but when it locks down and we can't get that motion in to get the good nutrients in and the bad nutrients out that have been used or the inflammation out, we really want that to be something that the body keeps an eye on rather than tries to overcompensate for. So sprain versus strain, there is a very distinct difference for this. So sprain is used when talking about a ligament, and a strain is used mostly when it's talking about a tendon. I know this is, we're talking about muscles. So when we're talking about ligaments, little anatomy lesson, ligaments are how we learned it in school is it attaches like to like. So a ligament attaches bone to bone, or a ligament will attach muscle to muscle. Tendons are what attach differently. So they attach bone to muscle and not bone to bone or muscle to muscle. That's all the ligament's job. So when we talk about sprain, that's when we hurt either the ligament or the tendon. A strain primarily is when it comes to the muscle, but it also can be where the contact is between the tendon and the bone. Ice versus heat. Now we have had a lot of research lately. I graduated last year and we talked at extent about the new research that was coming out over ice versus heat. Now I know a lot of people know the acronym RICE, which is rest, ice, and then the two others, elevation, and I can't remember C at the moment, I feel bad, but primarily ice is used to reduce inflammation. So when it's an acute compression, thank you. So rest, ice, compression, and elevation, thank you. So when we talk about ice, ice is used for acute injuries. So something that's happened recently or within the last 2-ish weeks. Anything after 2-ish weeks, we kind of want to use heat to help heal or help alleviate the inflammation. So when heat is used, it's used to increase blood flow. Ice is used to reduce inflammation. So a lot of people like using ice, which is better, but as we get older, our body really doesn't like using ice. So on our more experienced patients, the older patients, they are much better with heat because ice causes constriction of the blood vessels, and depending on what condition they might be working with, heat is just usually better. Second. That would be my alarm to take my son to karate. So if you heard that little jingle, that would be it. But he's in another part of the space. Hi guys. Yeah, I guess. So we just had 2 people show up. So what we're talking about, acute injuries, which happen within 2 to 7 days, can increase up to 14. Hi. I'm gonna switch sides. You guys can see. Injuries longer than 2 to 7 days are better to use with heat, as I said. If prolonged injury continues, pain can flare up existing injuries, which can be helped with ice. So rehab and prevention. Rehab and prevention, just rehabilitating the damaged tissues or rehabilitating the damaged muscles can be a great benefit, especially if you're locked down and you're trying to build strength back, build mobility back, all kinds of stuff helps with those. Preventative is continually putting into practice correctly learned movements to stretch and strengthen the damaged areas. So preventative is much better than rehabilitation because that means you've been prepared for what you're about to do, whatever athletic event, whatever sporting event you have. Preventative care is much better than rehabilitation. So what we learn during rehab and add new motion to help increase motions of the planes, that's preventative care. And big thing, if the muscle crosses a joint, you need to take care of it. There are a few big ones that cross the joint. There aren't many, but everyone knows the bicep, especially with, I forget the guy's name from Twister. His biceps are pretty big from what I've been told. But that one crosses the joint. So when we have an issue, we want to keep an eye on that. There are a few hip flexor muscles that cross the joint, we can keep an eye on. But again, a little more anatomy later. So common shoulder injuries. You ever injured your shoulder? What injury have you had? I don't know. It's still broken. Still. It's still not happy. Yeah. Okay, so common ones are rotator cuff, sprain or tear, supraspinatus, sprain or tear. So rotator cuff, this is Sally. I brought her in for a little bit. So rotator cuff, all in here. Not quite the labrum. There's just certain muscles that cross over the shoulder to help take care of that. Supraspinatus comes across up here on top of the spine, the scapula. Long head of the biceps, that's the one I told you about. So that one crosses right here in this little groove. I have you zoom in, but we'll worry about that later. So it crosses the joint up into here if we have any issues. So it's that little groove right in there. So that's the long head of the biceps. Pec major, everyone knows the pecs. They're the ones that come from like here, come across, and allows us to bring in our shoulders or lift certain things. So these muscles are the big ones for football, baseball, tennis, rugby, dance. A lot of them have specific orthopedic tests that we learn about in school. We don't do very often here just because we don't see very many people with tears or just dislocations, because those have to go to orthopedic surgeon in the ER, one to get replaced because chiropractors legally can't relocate a dislocated joint. We just deal with subluxations. So rotator cuff, as I told you, we got it's a combination of muscles. So one up here is the supraspinatus, infraspinatus, subscapular. So everything that's right up in here, and then it just kind of translates forward into the front of the shoulder. Quite a few exercises for the shoulder, eccentric loading, shoulder mobility, depending on the grade of the damage. So with certain tears, with rehab and motion, it can actually heal itself. If it's a full tear, unfortunately, that's got to be surgery, or you can kind of limp by. It's not very comfortable, but we don't have anything to really put it back ourselves. So if it's a partial tear, we can work with that and help build stuff back up. And then we got a whole list of exercises there. What time is it, Victoria?
6:15.
Oh, so I got 15 minutes, that's perfect. So shoulder prevention, just arm circles, nice big motion, trying to get everything loose. And then you always want to go the opposite way because it works different muscles depending on which direction you're going. Eccentric loading with resistance. So if you're holding a weight and you just sit there and hold, that's isometric, means that it doesn't quite move. Eccentric, and there's a different other entric that I'm drawing a blank on at the moment, but those ones are just used for higher weights and resistance. When you're doing certain motions, we want to make sure that stuff is stacked on the shoulder. So if you're trying to do like push-ups, you want to make sure your hands are just underneath your shoulders, because that's where a lot of the load's going to come from. If we start doing these outer portions, it puts a little more strain on the shoulders. Some people can do them if they have the right positioning for pec exercises. And then serratus anterior for push-ups. So certain things, if you have like a wing scapula, so if you have like a little scapula where it comes off like this, instead of resting right up against your rib cage. So there are certain exercises to help with that, but we also want to make sure that there aren't any buildup of scar tissue or any dislocated ribs or anything along that route. I know certain surgeries, augmentation or lumpectomies for breast cancer can affect the nerves that go to that muscle. So depending on if they do affect those nerves, we do have certain things we can do to help bring that wing scapula down. Next, elbow injuries, as I talked about earlier. So have you guys had any elbow injuries? Somebody had one. It was a dislocation of an elbow with tumble? Tramp. Tramp injuries.
Yep.
I had, let's see, I think I, not dislocated, but I really sprained my shoulder going from a fence onto a tramp, onto the ground when I was like 9 or 10, thinking I was cool. I'm sure it looked really cool, but the landing hurt like no other. So trampoline injuries are not fun. Okay, so common injuries for the elbow. As I said, tennis elbow goes this way, and then golfer's elbow as you're swinging this way. So tennis elbow primarily affects up here, golfer's elbow affects down there. It can also be when somebody's pitching too much, when they try to throw that curve, or they're just trying to get that flex in their arm. We have a few pitchers that come here with golfer's elbow or just some sort of issue right there. And tennis elbow and golfer's elbow kind of have a similar band that we put across to help alleviate that particular portion. of the muscle when it attaches to the bone, and we want that to rest while the rest of it's still, we want this portion of the muscle to rest while this one's still working. Hyperextension, some people can naturally hyperextend their elbow. I cannot, but some people it just naturally bends. Most guys can't, most women can, just because of certain hormones allow their joints to be a little more flexible. The Olympics are coming up, so if you watch Simone Biles or a couple of the other gymnasts, some of them can keep the arm straight and some go a little extra. They have really trained their body to know exactly what to do. So when you look at the male gymnasts, and some of them, when they do their floor exercises, certain ones can extend their elbows a little further, but that's because they need that flexibility for their events. Bursitis, tendonitis, there are a few bursas in the elbow, primarily right here. So when you have like a big, I don't want to say ball, but a big goose egg right there, usually a bursitis, and they got to do a few things to help with that. And I think that's on the next page. So.
Yeah. There we go.
Yeah, that was my, as I said, that was my alarm to go take my son to karate, but he's not in town right now. He and my wife are in Lake Powell. Well, I get to do this, and this, I like this a little bit better than any other. So, depending on the grade of damage, massage can be good. Eccentric loading, arm curls on the table, not with the bursitis, but with other exercises can be beneficial. So prevention, massage gun, muscle stretching, so a lot of extensor stretching and a lot of flexor stretching. So the bicep right here is the primary flexor of the arm. The triceps is the main extender of the arm. So stretching like this does the tricep, stretching like this does the bicep. Hands on wall stretches, we do all kinds of like leaning, and the more you rotate your arm, the better you feel whatever muscle is actually being stretched out. Common wrist injuries. I have broken my wrist multiple times, let's see, twice for football, once for soccer. Again, doing the cool bicycle kick that I've seen everybody do, but I did it indoors, and I landed with all my weight here on this arm. And then lots of fun came from that because I was in a full like elbow cast for quite a while. Because they didn't want me doing this, because doing this could have damaged more stuff. So but sprain, carpal bones, carpal tunnel can be an issue depending on what athletic events you do, but it mostly comes from being online. So, but I know some people.
They're done. Goodness, I gotta remember to turn on.
But I know a lot of kids and teenagers and young adults are doing video games as like their main source of athletic stuff now. So carpal tunnel can be added to this. Here, so wrist rehab circles to ensure, and I can't remember I have my, can you grab my little ball real quick, please? So ensure stacking motion. So when you're doing like the bar press, you want your wrist straight. You don't want it cocked like that. This causes a lot of damage and irritation. This just lines everything up and keeps it nice and straight. I can't do push-ups like this because of the many times I've broken my wrist. Thank you. So I have to do the knuckle up, so I have to keep my wrist straight and do push-ups and different angles. And it works, but it's a little uncomfortable. One rehab thing we talked about in school was this awesome little, basically a gyrosphere. So we wind it up, and then as the ball turns, it creates a force, and depending on which direction you turn it, this way does the flexors, and if I do this way, this one does the extensors. But the faster you do it, the more force it generates outward, and you gotta keep that rotation in with a specific turn. So try it out. The faster you make it, it actually turns on. You gotta hold on to it like a baseball, just so like your thumb touch the little spinning thing, that has a little inch. That's it. You gotta figure out how to do it. Roll your wrist. It doesn't roll. Yep. It took me about a day and a half to get it to go one way, and then about 30 minutes to go the opposite. It took a long time. Static opener for carpal tunnel. So there's a few exercises that help with the carpal tunnel. There we go. And 10 minutes. Okay, so hip injuries, common ones, the hips. And as a ballroom boy, my hips go really well because I was really well adjusted when I did this. But hip flexor strain, hyperextension, glute strain, piriformis. Piriformis we see a lot here, mostly because people are sitting all day long. So when you're sitting and you feel discomfort in your hips, it's because your glutes are weak. The piriformis is kind of like a bigger muscle that will take up a lot of slack. And if that's the case, then we gotta start building up the adductor muscles, so the muscles that go outward with your knees. And once those are strengthened up, it should alleviate a lot of the low back to glute pain. Adductor strain, so when you're bringing your knees together, hamstring, happens a ton to runners who don't stretch or they go a little overexertion down their run. Sorry, that was the word. And then quad strain. So that one happens a lot with lifters, so they're trying to do a couple of different positions that they're just not ready for. Rehab, single leg squat, so leg dependent. So depending on if one is doing better than the other, the single leg squat, so you come down, you come up, kind of looks like a lunge. When you want to do the lunges, you can do, we got one of our people doing wall sits. So you just sit at 90 degrees, you just sit there and hold it for as long as you possibly can, then you come out of it. Let's see, glute bridge, butterflies, hip tracking. So glute bridge, we can show people that when they come in, because it involves getting up and down. Massage is great for these, although some people don't like how I do the hamstrings. While I'm doing it, once I'm done, they're my best friend. So that gives you any indication. Nobody likes having their muscles worked on, but if you do it the right way after, you feel good. See, so hip prevention, massage gun, foam rolling. Dr. Bill is a huge foam roller. He does it every morning. I'm not that strict because my legs don't like the foam roller, but I should probably do it more often. Hip flexor stretch. We teach this one a lot to people. So you come down on a knee, and what you want to do is push the hip forward. You don't want to lunge forward because that's not going to stretch anything. You want to push from here forward, and you'll feel everything right stretch. That's the big hip flexor stretch. So you can do it laying down, you can do it on a bed, you can do it on a bench. Lunges are really good, squats, butterflies, knee to chest, so just this big stretch here. We a few weeks ago had a yoga demonstration done. That one was amazing. A lot of muscles that I thought I had stretched. She got me in a better position for it and got a lot better stretch out. All right, so common knee injuries. These are for the runners, the basketball players, the football guys. Basically, any sport can have knee injuries, but the big ones, ACL, PCL, so anterior, posterior, cruciate ligaments, that's what they stand for, ACL and PCL. So those can usually, majority of the time we see tears, but we can do sprains and help those out. Meniscus injuries, I tore my meniscus rolling out of bed. And I always love telling the story because you really can get injured in any way, shape, or form or any location very easily. LCL and MCL right here. So LCL and MCL. So that's the lateral side and the lateral side and medial side of your knee, and then offshoot slaughter. So that one is where the tendon actually has pulled the bone away from your tibia. Doesn't happen very often, but when people complain of pain or something there, what we do is we check the kneecap to see if it's moving properly. If it's not, if it's stuck, we get that moving, usually alleviates it, but if it doesn't, and it keeps getting more and more painful, we take an x-ray and can see if we have an injury that. Knee rehab. Oh, there are so many. The good exercises for knee rehab. So quad, IT stretching. So IT band right here. On 99.9% of people, this is tight, but that's primarily because it needs to be, but on some people it's tighter, and we want to get that stretched and loosened up, and then that can start to help out. Quad loosening, so quad stretches, lunges, wobble board, we don't have one here, but they have them in a lot of PT offices, which can be really beneficial. Band tracking for knee stabilization. So we don't have any bands here, but if you look them up online, there's quite a few exercises. Sure, I got 5 minutes, we should finish on time. So prevention, foam rolling, TV ball work, those can be amazing. Single and double leg squats, so squat with one leg, squat with double, make sure the knee is tracking over the ankle. We don't want anything out here or anything in there, that's just not good biomechanics for 1, your knee, 2, your hip, and 3, your ankle. It just doesn't bode well for those. Common ankle injuries. Number 1, everyone knows, rolled ankle. Always, well, I wouldn't say always, more than 60% are external or with an inversion of the ankle. Not very many happen this way, but when they do, that's usually when the breaks go. When we do this one, there's a little bone inside the foot. Let's see this one. So this little bone right over here, right off the pinky toe. Whenever that rolled ankle happens, that fracture can happen very, very easily. Most common happens with basketball players when they go to their jump shot and roll their ankle. Like the athletic trainer comes over and double checks that bone because if it's broken, player can still run. They don't recommend it because it's just going to get worse. All right, Achilles tendon rupture, or tear or inflammation. We usually hear more about the tear because it sounds like a gun going off. It's a big. You don't feel any pain. You don't know what's going on. You just heard a great big snap, and then we check certain tests. And if your foot doesn't flex a certain way, we know that we have Achilles tear. That unfortunately requires surgery. Plantar fasciitis. This one we have a few people that we're treating currently with. It's just inflammation of the bottom of the sole of your foot. So there's lots of tendons, ligaments, fascia that just aren't gliding properly, gets inflamed. And primarily hurts when you wake up. As the day goes on, it kind of gets a little better because you're moving your toes, you're moving your foot, kind of warms everything up. These ones I hate, shin splints. They are horrible for runners, soccer players. And it's just a great big, like, not a tear, but a great, feels like everything is tearing from your shin bone off to the side. Anybody have shin splints before? Oh, you are a lucky person.
Plantar fasciitis.
Yeah, okay, I take it back.
Yeah.
No, I'd rather have shin splints than plantar fasciitis, but I've had shin splints a few times and they suck. Yeah, and then the big one, drop foot. Drop foot requires, like, if you're like trying to pick your foot up and it just flops there and you can't quite get it to raise like it's supposed to, we want to check for disc or nerve issues up top as the big scary one. Outside of that, we just want to make sure that the nerves are flowing properly down. Rehab stretches. There's a few stretches. The big easy one is the stair stretch. So you put your toes just at the top of the stair and you just push forward and lean, and this whole thing stretches. Or you can get on the stair just with the balls of your feet, and then you just let your heels drop. Great stretch. I make my son do it all the time because his calves are incredibly tight. Primarily because he runs a certain way, but we're trying to get him to not run that way so that his calves will work properly. Massage, so anterior tibialis, so this muscle right here, where the shin splints come from, massage on that is really great. Gastroc and soleus, so those are the two muscles back here on the back of your calf. Flexor digitorum and pronis, so that one's all about flexing the foot. Prevention. Prevention we like to talk about with this one because you do ABCs in the air. All you do is your toes form the A, the B, the C, and you just go all the way through the alphabet and you switch. It's all about the movement. I think I've started saying motion is lotion because I heard that at one of the seminars I went to. Just the more motion you get, the more lotion is inside your joints, the better there. Anterior tibialis stretch and strengthen. So stretching, just pointing your toe off to the sides, can stretch different versions of that. Strengthening is just calf raises, and then some other ones that are, when you come here and you do the little wall sit, you just raise your toes up. And that one is a pure anterior tibialis workout. It'll burn rather quickly if they're weak, and then you know exactly what to do. Gastroc stretch, so again, that one ankle tracking with band, so put a little band around your ankle, and it's just a nice big stretch. Sure. Okay. So we'll do the end of that. Do you guys have any questions about anything? I know we kind of got a little started and you guys came in later, but
No.
that's okay. Okay. Now we do a lot with more lower body here, I think, than upper body when it comes to injuries. But yeah, I look over to you like, you pay attention to everybody here, but okay. Do you guys have any questions or anything?
Thanks for coming.
Have a crunchy shoulder.
Crunchy shoulder.
My elbow's still hurt.